you have your notepad and pen ready. If you don't, grab one or have a facility on your phone and take lots of notes as we go through. But we'll get started so that we can keep to time and we can end on time. And as I said, enjoy the session. So as Carol said, we are running the second session of the Managing Nutrition in Sickle Cell Disorder. And this is all about helping you know and manage your sickle cell related nutritional needs. So there's a lot of slides to get through, but hopefully we'll be able to stay on time. And as I said, you'll be able to get some really helpful information. For those of you who are joining for the first time, I am a dietitian by background, and I've been involved in advancing sickle cell nutrition for the last 10 years. And so I know some things, there were things I may not know. I'll have to research, but hopefully, we'll be able to get through today. So I'd like to start the session by just going through, taking you through an overview of the four virtual sessions. And as I said, we had session one, which was last week, which was the introduction to sickle cell nutrition, the clinical causes, specific nutritional needs, risk and challenges of sickle cell patients. And so today, session two, it will be all about helping you know your nutritional needs, risks, and sickle cell related factors affecting your nutritional needs, but also we'll have a practical part of the session to help you use the Eat Well guide to support your nutritional choices and behaviors. So next week, so please make sure to, after the session, register for next week. Next week's session will be fantastic as well. And that will be a focus on key nutritional deficiencies, additional factors linking nutrition to health and well-being, and lots of practical tips and nutritional strategies to help you live well with sickle cell to optimize your health and well-being. So I'm excited about session 3, and then session 4, which will be in 2 weeks' time. So please remember to register. It will be a session all about practical tips and nutritional strategies to help patients better manage common nutritional problems to improve your nutritional health and well-being. So that's an overview of the 4 sessions. So we'll move on then to the agenda for this evening. So as I said, it's quite a long session. There's 6 parts, but hopefully we'll be able to get through all of them. Some sessions parts are smaller and shorter than the others, so hopefully we'll get through everything. But I will start off with a recap of the previous session, because as I said, that these sessions will be building on the knowledge and information shared. So I'll do a brief recap just as a means of laying a foundation for what we will cover today. Part 2 will be all about helping you to know your nutritional risks. It's really important to be able to identify your risks and also have a sense of what are those wider influencing factors affecting nutrition in sickle cell. Part 4, which will be the main part of today, is all about helping you know your sickle cell related factors affecting nutritional risks. And this might be information that you may not have heard before. So do, as I said, take notes as I'm going through. Part 5 is the practical bit. It's all about applying the Eat Well guide to managing your nutritional risks, your choices and behaviors. And then, as I said, I always like to end off with part 6 for this evening, which is all about empowerment and lifestyle tips, but almost as a summary of what we would cover through this evening's session. So again, for those of you who don't know, just a little bit of my background, as you can tell by the accent, I was born in South Africa during the apartheid regime and experienced firsthand racism, marginalization, and disempowerment. So when I speak from a lived experiences of having experienced these things. But the positive thing for me is that has left me with a worldview for social justice, advocacy, and empowerment, which has really underpinned, my work that I've been doing in advancing sickle cell nutrition. I moved with my husband to the UK in 2000 and was introduced to sickle cell in 2011, worked in a sickle cell service for 4 years. But in 2014 is when all of this came into being, where I was introduced to sickle cell nutrition. And, as a dietitian, I was keen to know more and discovered there wasn't a lot happening in this area. And that's how all of this came about. I wanted to develop a national nutrition strategy for sickle cell in 2015, and it was advised by a GP that I was working with a special interest in sickle, and said for what I wanted to do, policy and practice change, I needed to do a doctorate. So in 2016, I took the bull by the horn and enrolled on a professional doctorate, self-funded because no one was interested in supporting me, and completed in 2023, at the end of 2023, at which point I then also founded my nonprofit called Sickle Cell Nutrition Academy. And I now work as a consultant dietitian advancing sickle cell nutrition. So now we're coming on to part one, which is the recap of what we've done in session one. So what I want to highlight in this slide as we recap or start this recap is to take note of why the integration of nutrition in sickle is that important. And it is all about safety, is providing safe, a high quality of care for patients, not only in relation to the medical management, but also in regards and in relation to the nutritional management, which we know for many of you, there's not a lot of service provision out there currently. It's also about your patient experience. How do you experience your healthcare provision, but also building the platform so that we can improve your experience of nutritional care as we grow the nutrition as part of the standard management of sickle cell patients. In addition to that, it's all about improving your quality of life outcomes as well through your medical management, but also through the nutrition, which is why this course is so important. But what we want is not just the safety and the patient experience and quality of life. We also want patients to be able to live longer, but live healthy and long. So that's important, in terms of nutrition. And nutrition, as you would have experienced with the first session, does definitely play a role in how well you can live with sickle cell. It's also about reducing health inequalities. And we know in regards to the lack of nutrition service provision being a health inequality, this work is all about addressing that. And it's wonderful that the Red Cell Network has made this possible. And so again, thank you to the Red Cell Network for putting on, this important program. And all of this cumulatively works together to improve your health outcomes. And, it's my hope that, as I said, by the end of each session, but certainly at the end of the program, you will have got enough information to make a positive contribution to improving your health outcomes. So in all of my presentations, I always include this slide. And so some people still don't know how nutrition links to the sickle cell disease. And so that's why this slide is a slide you will be hearing throughout the program. And it is highlighting how these three main clinical features linked to sickle cell is responsible for the nutritional problems or manifestations that you may experience living with sickle cell. And I'll start with the first, which is the chronic hemolysis, and that's the rapid breakdown of your red blood cells. And as you can see listed just below, the implications or the impact of this chronic hemolysis results in the chronic anemia and fatigue that you may experience, the increased red cell turnover. That means your body has to make more red blood cells in a very sort of rapid pace, where normally red blood cells will live for 120 days. In sickle cell disease, that's reduced down to between 16 and 31 days. There's increased cardiac demand and expenditure. So as you have lower red blood cells and lower hemoglobin, you have less oxygen perfusing cells and tissues, and that has an impact on how well the heart can do its work in pumping the blood and perfusing the tissues and cells and organs of the body. It also results in increased oxidative stress, which is just that imbalance of harmful substances that can cause tissue and cell damage and also chronic inflammation. So vasoocclusion, you will know, that's the medical term for your sickle cell crisis, which is the blockage of small and large blood vessels with sickle-shaped red blood cells. And this can result in a reduction of blood flow called ischemia, or the blockage of blood flow called infarction. And this is what causes the tissue damage, the organ damage that you experience. And we'll touch on that in the presentation later on. And this cumulatively also leads to chronic inflammation. Furthermore, you have an impaired functioning of the spleen, and again, we will touch on this later on, and this leads to impaired immunity, which increases your risk of infection, and this can increase your risk of malnutrition by increasing your nutritional requirements and also result in chronic inflammation. So we started off our talk last week by asking this important question: why is good nutrition important? And good nutrition is important because it's all about helping you to build a good nutritional status. And what is a good nutritional status all about? It's all about eating a balanced diet. And you would have heard a lot in session 1 about that, but we will be continuing that narrative, that information, and calling for or highlighting the importance of eating a balanced diet. But a balanced diet means that you have to eat the right amounts of food. So the quality of the food as well as the quantity of the food, but always thinking about your cultural foods and preferences. And again, this evening, we will touch on a lot of that in particularly part 5 of the talk. So in addition to that, it's about choosing the right variety of food, because not one food contains all the nutrients you need. So we have to include a variety of foods. And this is to boost the individual nutritional needs, of sickle cell patients, so that your body can function optimally, but also so that you can enjoy a good quality of life. You've already referred to a quality of life, and so that you can enjoy and do the things that you enjoy doing. So the other thing we mentioned in session 1 was also, what is the evidence of a good nutritional status? What are we looking for, certainly from a dietetic perspective, in terms of a good nutritional status? So we've already touched on the healthy, balanced diet, but what we also look at is your anthropometry. So that is the measurement of your size, proportion, and body composition. And key things that we look at is your weight, your height, and then we use those two numbers to calculate your body mass index, or your BMI, which is a ratio of your weight in relation to your height. And we looked at how to calculate your BMI. And if you go onto the NHS Choices website, which we identified last session, you can actually calculate your BMI. It's important for you to have a sense of what your weight is and what your height is. So if you don't know, because many patients don't know, I would say find out, because that will also give you some helpful and valuable information, certainly in terms of whether you've lost weight or whether you've gained weight, because those are the two other elements that we look at when we're looking at establishing someone's nutritional status, whether they have a good or not so good nutritional status. So weight loss, unintentional weight loss, so you're losing weight even though you're eating well, that is a significant red flag. So we do need to look at that, and we'll talk about that in a little while in a bit more detail. Weight gain, are you eating more, taking in more energy than what your body's using, or are you holding on to fluid that shouldn't be there? And so it's important, again, to know your weight, because that will help us to establish weight loss or weight gain from your baseline. But also we'll look at inflammation, and the previous slide highlighted with those 3 clinical features, they all result in chronic inflammation. So we know sickle cell is linked to chronic inflammation. And we look at this cumulative effect of disease burden that sickle cell can have, on your quality of life, and how you experience sickle cell in terms of the signs and the symptoms and the complications. So all of these factors are really important when we look to evaluate and measure your nutritional status. So all of this is important because what we want to do is we want to prevent malnutrition. So what is malnutrition? Very briefly, it is caused most when you are not eating enough of the right kinds of foods. We said you need to eat the right kinds of foods, the right amounts of foods, the right variety, of a good variety of the foods. And the reason why we need to do this is so that your body, can the food that you eat can actually meet your body's nutritional needs, your specific nutritional needs. And if we don't do this, then this can cause an imbalance of the essential nutrients that the body needs to keep healthy, to stay energized, and to be strong. In addition to this, there are also some sickle cell related factors which we will go through in the presentation. And so you can see there's so many things related to the diet that is important when we look at preventing malnutrition or this imbalance of essential nutrients. And so we ended off last session with this slide looking at what are the benefits of good nutrition, certainly in terms of improving your nutritional status by eating a good balanced diet. And there's a number of benefits that we identified. So it helps you to stay healthy for longer. It helps your medication to work better. Your treatment modalities that you have, to manage your sickle cell. It potentially can improve your mobility. So that is the signs, the symptoms, and the complications that you have associated with sickle cell disorder, potentially reduce the impact of the side effects of your medical treatment, potentially reduce the frequency and the intensity of a crisis. And I've spoken to several patients who have included and increased their dietary intake and following more of a balanced diet, and they've seen this marked reduction in the frequency and intensity of their crisis. But also many patients have said, they normally would have a longer hospital stay, but because they're eating better, that they've noticed a reduction in their length of stay and their recovery rates as well when they in hospital or at home recovering from illness or from a crisis. But also it can help to reduce the medication that you manage. And so in these few slides I've just talked you through, that essentially is sort of the main points that we covered in session 1. But there will be a recording. So if you want more information regarding session 1, then wait for the recording and you can get that as well. So some of you asked some questions, and so this next slide is an attempt to answer the questions that was posed at the end of the presentation. So the first question was around cost-effective alternatives to dietary restrictions for those patients with sickle cell who also have a condition called G6PD deficiency. So my answer to that is I don't know a lot about it. So I will go, after I've completed this program, we'll go away and look at the information in relation to the deficiency. I will put together a leaflet that I will make available on the Sickle Cell Nutrition Compendium that's on the website, but I'll also will share it with Stuart. So hang 10. I've noted your question, and I know someone has asked this before. I've just not had the chance to look at this, but the information, I will do my best to try and put some information together for you. The second question I was asked is, what's the difference between demerara, cane sugar or brown sugar, and white sugar? So essentially, it comes down to processing. The demerara or the brown sugar undergoes less processing and contains more of the molasses, which gives it the color, the flavor, and the moisture, the higher moisture content, whereas white sugar undergoes a lot more processing to remove the molasses. But essentially, in terms of nutrients, whether it's brown sugar, cane sugar or demerara sugar, in terms of nutrients, it both contains the same amount of calories and only contributes to energy. There's no other nutrients, no vitamins, no minerals. Yeah. So in the last session, we spoke about how many cubes of sugar is good for an adult over I think 11 years old. So if for those of you who were in the first session, if you know the answer, put it in the chat. I'm going to check afterwards, so I'm not going to give the answer. So that's some homework for you. So question 3 was about tinned foods and whether fish, tinned foods or pulses is good and works as well as fresh. So the answer is to pay attention to the salt and sugar content of tinned foods. Tinned foods can be a really good cost-effective alternative, so definitely has a role to play in the diet. But if you're thinking about tinned fish like salmon or sardines, so there is a slight reduction in the omega-3 content, particularly for salmon as opposed to sardines. So just to bear that in mind. Some vitamin loss in terms of the water-soluble vitamin C and B, and a lower fiber content. And so if you are having tinned food, which I do, and definitely in terms of salmon and your fish, I buy that because it's slightly cheaper, but it is about balancing, having tinned foods, but also having some fresh foods in your diet as well to make up for some of those losses, as I've just highlighted. So the next question was about hospital food, and I get asked this question a lot. I don't have a really good answer to that, but what I will say is, and actually, in fact, this week is National Nutrition and Hydration Week. But the BDA has supported the production of this digest, the Nutrition and Hydration Digest, and this has been developed by dietitians, so with expert knowledge in the area of food and drinks. So all of the food that you eat, as part of the hospital foods, this information is backed up by science and backed up by healthy eating guidance. And so technically, the food that you have should reflect the recommendations from this high nutrition and hydration digest. So I would say that if you are in hospital, ask these questions. Ask about, what they're doing, how are they preparing the food if you're not happy with the food. And hopefully by you asking these questions, that information will stir people on to pay more attention and to make the changes if the quality of the food that you're given isn't, up to standard. But it should comply with the information that's contained in this nutrition and hydration digest. Hopefully that answers your question. So that's the end of part one, which is the recap from last session. As I said, if you want to listen back, wait till the end of the program and you'll be able to listen to that full presentation. So we're coming on to part two, which is knowing your nutritional risks. So this slide I shared in session one, and I think it's important again just to highlight, what are those nutritional manifestations off the back of those clinical features that I mentioned, the chronic hemolysis, the vaso-occlusion, and the impaired immunity. And so I've listed some of those key nutritional problems that patients will experience, and some of them relate to what's called a high resting energy expenditure. And all that means is that for some patients, particularly the HBSS genotype, they will expend more energy even at rest. And so they will have an increased energy requirement. So it's important to be mindful that this is a reality for some patients. Also, you will have high protein and red cell turnover. Remember, I said non-sickle patients, their red blood cells will live for up to 120 days. For sickle patients, that's markedly reduced down to between 60 and 31 days. So your body needs more protein and needs to make more red blood cells. And so you will have a higher need for more protein to be able to do that, and some other nutrients as well. Because there's less red blood cells, there's lower oxygen, hemoglobin levels, and therefore lower oxygen levels. And so the heart has to work so much harder to pump the blood and to perfuse your tissues and your organs. And so, this increases the energy requirement that you may need as well. We already mentioned the impaired immunity because of the impaired functioning of the spleen. So that will increase your risk of malnutrition, increase your nutritional requirements. Some patients will have a low body mass index. Remember, low body mass index, to calculate that, you need your weight and your height. So that's why it's important to know those factors. But I also mentioned the oxidative stress and the chronic inflammation. So these are some of the common nutritional manifestations or signs and symptoms that patients will experience. And this relates directly to the nutrient deficiencies that you will experience. So in terms of macronutrients, so energy that you get from carbohydrate foods and from fats, and also your protein foods, because you've got this higher protein turnover. We also know that for sickle cell patients, you have a higher fluid requirement, and so pay attention to that. When it comes to the micronutrients, your vitamins and minerals, there are key nutrients that has been identified through scientific research to be lower in sickle cell patients. So we mentioned zinc, selenium, vitamin D, your antioxidants, vitamins A, C, E, your B vitamins, including folic acid. Iron may be low, but, again, if you're looking at iron, taking into consideration whether a patient is iron overloaded, and also patients can have a lower omega-3 fatty acid. So the next two slides is literally to identify 4 key nutritional concerns that you need to be aware of when you're living with sickle cell. And firstly is your appetite. So this is something that I get asked quite a lot. And it is a very common problem experienced by sickle cell patients, and particularly patients will experience a reduction in appetite when they have when they're experiencing a sickle cell crisis. And certainly at home, but also if you're admitted to hospital with the crisis, this can significantly affect your appetite. And when your appetite's affected, it means that your intake your food and the energy and the protein and the vitamins and minerals that you need will be affected as well. And that can increase your risk of malnutrition. So it's really important that when you are experiencing a reduction or reduced appetite, that you flag this, that you identify this or inform either your nurse, sickle nurse, consultant, or your GP, so that you can be supported through this phase, because what we don't want is for you to not eat enough of the foods, and we mentioned eating enough foods, as a risk of malnutrition. So pay attention to your appetite. The next risk or concern to identify is unintentional weight loss, and this means that you're losing weight even though you're eating well. And again, this can be a common occurrence for some sickle cell patients. So you want to not allow this to go unchecked. If you are experiencing unintentional weight loss, where no matter what you're eating, you're still losing weight, you have to flag this up. You have to contact and speak to either your nurse, as I said, or your GP or your consultant, because again, we want to prevent this from affecting and increasing your risk of malnutrition, which can have a detrimental effect on your nutritional status. Unable to gain weight after illness. This again is a significant problem, because again, is it because you're not eating enough? Is it because your body isn't absorbing the nutrients? Is it because you have increased nutrient requirements? And again, this is something that you shouldn't ignore, that you need to identify, you need to flag up, pay attention when this is happening, so that can, you can get the help and support to prevent you from, as I said, having an increased risk of malnutrition or becoming malnourished. Then the fourth key nutritional concern I want to highlight as well is worsening anemia and fatigue. Now we know that chronic hemolysis, this ongoing breakdown of your red blood cells, is what results in your chronic anemia and fatigue. But if this is worsening, if you normally experience anemia and fatigue, but it's become worse, then again, you need to seek help, advice and support around this, because again, is it because you've got increased requirements, or is there something else going on in the background, some other illness, that's increasing your nutritional requirements? And so, you want to get that help and support as soon as possible, because as I said, what we want to do is we want to reduce your risk of malnutrition, so that we can help to, ensure that you are building a good nutritional status. So the other key nutritional risks I want to highlight now is also paying attention to when you're experiencing multiple or lasting infections. Now we know that infection, because I've mentioned this already, can increase your risk of malnutrition. So if you are having ongoing infections, this over time can continue to increase your nutritional requirements and increase your malnutrition risk. And this can lead to other problems and can definitely have a negative impact on your nutritional status. So you want to, again, seek help as soon as possible, and not almost suffer in silence and hope that things will improve. You need to take action as soon as you start, identifying this as an ongoing problem. The other thing to identify as well is when you have frequent hospital admissions. We know from other chronic conditions, patients who have frequent and long hospital admissions, they are at an increased risk of malnutrition. So if you already have, signs and complications of sickle, and now you have ongoing frequent hospital admissions, you need to speak to somebody again to assess your diet, to assess, is there anything else underlying that's driving these admissions, so that we can reduce your risk of becoming malnourished. The third thing I want to highlight is if you are having worsening complications, because usually worsening complications means that you potentially may be experiencing more crises. And we've seen in the previous slide that if your nutrition is good, if you're eating a well-balanced diet, right variety, right amounts of food, that can reduce your frequency and intensity of a crisis. And so if that is happening and that's leading to a worsening of your complications, then again, we need to know about it, so that we can, do a good nutritional assessment, and see if there's anything else going on, and how we can nip things in the bud and prevent you from, worsening or increasing your risk of malnutrition. The fourth thing I want to highlight is your decreased functionality. So we know that sickle cell is associated with reduced and poor quality of life, but also reduced disability. And so if you have reduced functionality, then this again can impact on, how you're eating, being able to make the food, buy the food, prepare the food, etc., do the things that you need to do, engage in physical activity, etc. So don't dismiss it as, oh, it's just I can't do what I normally used to do. This potentially can have an impact on your nutritional status, and so we do need to know about it. So definitely seek help, so that this can be nipped in the bud. And as I said, you can have that assessment and just ensure that it doesn't have a lasting effect on your overall nutritional status. So that's the end of part 2, and I hope with those couple of slides there already you can see that there's a lot of things that can affect your nutritional status, your nutritional risk, your malnutrition risk. So you do need to pay attention to these. So we'll move on to part 3, which is, again, knowing some of the wider influencing factors affecting nutrition in sickle cell disease. So for those of you who were in session 1, you would have seen I've shared this slide, and this is all about just highlighting that sickle cell nutrition is not just about the food. I have been speaking quite a lot about balanced diet, but there are other things that you need to pay attention to that can impact on your nutritional needs, and nutritional assessment as well. And so some of the things like medical considerations, pain, I've mentioned pain, and I've mentioned pain in the context of affecting your appetite. So, it's important that you consider that as well. What is it, are you taking pain relief, pain medication? What are the side effects of this pain medications? Is it nausea? Is it vomiting? Is it constipation? That can also impact your nutritional assessment. And so we need to pay attention to the medical considerations. But there's also psychosocial factors. And we know that with sickle cell patients, they can experience depression, anxiety, worry, stress, and all of that can have an impact on your food choices, your health behaviors, etc. So we do need to factor that in as well. But also the wider determinants of health, so socioeconomic factors, your education levels, your employment, your income, etc., etc. And all these things, as I said, cumulatively play a role in adding to the complexity of sickle cell nutrition. So when I was doing my research, my doctoral research, I wanted to understand from sickle cell service user and carer perspectives, as well as providers, what are some of those factors that can impact on, the nutritional needs of sickle cell patients. And this slide basically is a summary of some of the findings from my doctoral research. And so to do that, I applied what's called a socioecological lens. And a socioecological lens basically looks at the personal, interpersonal, institutional, policy, and community level factors. And this slide basically just highlights the personal, the internal personal, and the external personal factors that can have a role to play in your nutritional needs, and that you need to be aware of. And those dietitians and healthcare professionals assessing your nutritional needs need to be aware of. So psychological factors, as I already mentioned, are you experiencing depression? Are you experiencing low mood? And again, when I was doing the research, and also when I was doing the NHS England project, low mood was identified as a clear factor for some people in terms of what they eat, how much they eat. And so that in itself is something that we need to think about. Your emotional state. Are you sad? Are you isolated? What's your attitudes? What's your beliefs about food? Your cultural factors, traditions, food traditions as well. Stigma, in terms of living with sickle cell disease. Your religion. We know many patients are fasting at the moment from a Ramadan at the moment. That can also impact, on what you eat and when you eat and so forth, but also your health symptomology. So one of the patients, as part of my doctoral research project, identified her fatigue and the impact that her fatigue had on her ability to prepare her foods. And so she relied on her family, on her daughter specifically, to prepare foods in advance and to have foods available as well. And so these are internal factors that we do need to consider when we're thinking about sickle cell nutrition and how these factors affect your nutritional behaviors, your nutritional needs, your risks, and your challenges. And some of the external factors that were identified through the research was your environmental factors. And one in particular patient mentioned that she works in an organization where they provide all the meals. And so the meals that she had depended on what was available within her work environment. And so that's something that we need to consider. Having enough time available to cook from scratch, as a parent or even as a young person if you're living on your own. So time is an important factor to consider. Your knowledge of nutrition. Many patients have said, what do I eat? I don't know what to eat. So this course is really important, again, to help, address that. So having the right nutritional knowledge is important. Having family support, again, cultural choices and beliefs, food traditions, and peer support. Having family support, but also peer support, is important, particularly for those people who live on their own. Having access to support, particularly when you're feeling when you're experiencing fatigue or tiredness, or when you've got a crisis and so forth. And so this slide, as I said, is important for you in terms of understanding the multifactorial nature of sickle cell nutrition and what you need to be aware of when you're looking at the nutritional needs of sickle cell patients. So that's the end of part 3. We're whizzing through quite nicely. And so now I want to come in on to part 4. So knowing some of the sickle cell related factors affecting your nutritional risks. And I'll again, this slide I shared in the first session. And so what I will be doing in this part of the presentation is to talk you through all of these, or how sickle cell affects the multiple organs and systems of your body. We know it's a blood disorder, so it flows throughout the body. So all of your organs and systems can potentially be affected by sickle cell disorder. And so I will talk you through each of that over the next couple of slides. So again, this slide is just to say that those problems that we will be talking through the next couple of slides that will have related nutritional risks, can potentially increase your malnutrition risk, can potentially increase your nutritional needs risk and challenges. And that's why I've included these slides that I will go through as part of this presentation, and again highlight some of the complications that you may already be experiencing or know of that other people are experiencing, and how that impacts on not only your medical health but also your nutritional health. So the micronutrients, the macronutrients, that you need to be including in your diet to overcome that increased energy requirements as a consequence of these sickle cell related problems, the fats, the proteins that you need, as well as the vitamins and minerals. So I'm going to start off with the skeletal system. And so how this will work is I'll talk you through the function so that you understand what the function of the various systems of the body are, how that the impact are, how this impacts sickle cell, and then I will talk you through sort of general and some sickle cell specific nutritional guidance so that you can know how to manage the nutritional related problems relating to each of the systems. So if we start off with a skeletal system, so what does the skeleton do? The skeletal system helps to provide the body with support, as helps you maintain your body shape and your posture. It helps with movement. It protects vital organs of the body. It helps with blood cell production, mineral storage in terms of vitamin D, calcium, phosphorus, but also to prevent and reduce the risk of injury to the body as well. So how does this impact your sickle cell, or how does sickle cell impact the skeletal system? So many of you on the call may have experienced or know of people that have experienced osteonecrosis. And osteonecrosis is basically refers to the reduced blood flow to bones. And avascular necrosis is an example of that. And, you, as I said, you may experiencing, you may already have avascular necrosis or know of people and the pain associated with that. Osteomyelitis is another impact of sickle cell on the skeletal system, and that is basically infection of the bone, and it can also affect leg ulcers, and that's reduced blood flow to the lower legs. And we know patients who experience leg ulcers, chronic leg ulcers, again, the pain associated with that. And so and hopefully with the next couple of slides, I'll share some of the nutritional sort of behaviors and choices that can try and address some of these problems. So if we start off with the bone health as it's affecting the skeletal system, so what are some of the general guidance to be aware of here is to ensure that you take in enough calcium and vitamin D rich foods. We know that vitamin D is needed for calcium absorption and to maintain the calcium and phosphorus level of bones. So we need to also include enough protein-rich food. So for those of you who follow a normal diet, you can, that can be through animal products, meat, through fish, eggs, and for those of you following a vegetarian diet or a vegan diet, examples, tofu is a good source of protein for you as well, but also to ensure that you're taking enough fruits and vegetables. So remember your 5 a day. Some people in the chat in the last session mentioned that they maybe have a piece of fruit a week or maybe 1 or 2 fruits a day. So I want to encourage you to work on that, to make that a goal, to increase it to your 5 a day. So in terms of bone health, trying to ensure that you have some of these nutrients in your diet. So thinking in terms of leg ulcers, so some of the general guidance around wound healing in particular, again, eating a healthy, balanced diet. We started off the presentation with that, and that is the foundation for living well and eating well, living with sickle cell disease. So definitely eating a healthy, balanced diet, the right amounts of foods, the right variety of foods, including protein-rich foods, because we know that protein is important in terms of repair and building. So we want to ensure that you get a good amount of protein in your diet, including vitamins, particularly vitamin C, vitamin A. So foods like citrus fruits, your oranges, examples of My brain's just gone. So berries, strawberries, blueberries, blackberries, etc. Peppers, tomatoes, broccoli, carrots, spinach, and mango. So ensure that you have this variety of foods in your diet so that you can get the vitamin C and A that you need to support wound healing. In addition to the vitamins A and C is minerals like particularly zinc. So seafood, poultry, eggs, red meat, and again, as I mentioned before, for those patients following a vegan or vegetarian diet, you may need to get this through a supplement, nutritional supplement, but also ensuring that you take in adequate fluid intake, because we know that when we don't take in enough fluid, that can dry out the skin, and that can worsen leg ulcers. So you want to ensure that you're taking enough fluid in terms of, improving and maintaining the good integrity of the skin. But you also want to take in a good amount of energy, because we know that, again, with protein foods, if you don't take in enough energy, the body will start using protein for energy. So we want to ensure as well that you take in a good amount of energy to support that the healing of the ulcers. So moving on to the genitourinary system, and so the function of the system is in regards to reproduction or reproductive health, also waste removal, so filtering extra water and waste out of your blood. It's responsible for hormone homeostasis, metabolism, and also volume status. So what's the impact, what the impact of sickle cell in terms of the genitourinary system? So it can lead to chronic renal insufficiency or chronic kidney disorder. And some of you, as I said, may already experience this. Chronic renal failure, so the body's inability to filter waste and fluid from the blood, and also priapism in men. So what can we do about this? So in terms of nutritional risks, we want to ensure that you're taking, again, balanced diet using unprocessed foods. You want to include in your diet a good variety, your 5 a day of your fruits and vegetables, including whole grains. So whole grain in terms of having brown rice, having brown pasta, having oats, and lentils, beans, nuts and seeds, all of that in your diet, including lean proteins like chicken, turkey, beans, lentils, and limiting the intake of salt, sodium, potassium, and phosphorus in the diet as well. And instead of using salt in your foods, using more herbs and spices. So this slide, sickle cell nephropathy, was also a question that was asked at the end of session 1, and so I included that the answer in as part of to this part of the presentation. So sickle cell nephropathy. So how to address issues like proteinuria via your dietary regime. And so sickle cell nephropathy is another name for proteinuria. So it's a condition that's characterized by abnormally high levels of protein in the urine. That's where you get the proteinuria from. Sickle cells block the blood flow in the kidneys, particularly the small blood vessels of the kidneys. And it is recognized as a common and a significant complication of sickle cell disorder. So what you need to do, in addition to the nutritional side of things, is you have to comply with your medical management, certainly in terms of hydroxyurea, because this obviously is aimed at reducing the frequency of the sickle cell crisis. And as I've mentioned earlier on, the problem to the kidneys, the damage to the kidneys, is because of the sickle-shaped red blood cells, blocking the flow of blood in the small vessels there. So you want to reduce your risk of sickle cell crisis. Important, I've already mentioned, is hydration. So drinking enough. We know that the sickle patients have an increased fluid requirements. So you want to drink enough fluid. Enough fluid can be you drinking up to 8 to 10 or more, depending on sort of, the environment. If you have an illness, you may be losing a lot more fluid, so your fluid requirements may be higher at that point, but at least 8 to 10 cups of fluid a day on average. And as I said, that may change and vary depending on circumstances. In hot weather, that may increase as well. So making sure, again, that you're eating a balanced diet, eating adequate lean protein, so poultry, fish, legumes, beans, having fruits and vegetables in your diet, avoiding processed foods that contains high amounts of salt and phosphorus. Also important to manage your blood pressure and reduce your salt intake. That's really important. So if you are suffering from sickle cell nephropathy, you need to check and monitor your blood pressure. And if it's high, obviously that needs to be managed to reduce the stress that's placed on the kidneys. If you have diabetes as well as living with sickle cell, you want to ensure that you have a very good blood glucose control, because again, having high levels of blood sugars or high blood sugar counts, that can also affect how well the kidneys work. So you want to maintain a really good blood sugar levels within the 4 to 7 range, or 4 to 8 range. And then also, in addition to the nutritional, what I've just mentioned there, you also want to pay attention to lifestyle factors such as engaging in regular activity, limiting your alcohol intake, and if you are smoking, please stop or avoid smoking. So hopefully that would have answered the question to what do you do, how do we address issues like proteinuria via your dietary regime. So moving on to the gastrointestinal system. So the function of the gastrointestinal system in the body is to support the ingestion, digestion of food, the absorption of nutrients from the food that you eat, also to secrete water, enzymes, and also to excrete waste products from the body. So what's the impact if you're living with sickle cell? Cholelithiasis, and so that is the development of gallstones. And usually the gallstones in sickle cell comes because you have high levels of bilirubin. That is as a consequence of your this chronic hemolysis, this ongoing breakdown of your red blood cells. And so many patients will experience cholelithiasis or gallstones because of that. Some patients may experience viral hepatitis from transfusions, and others may go on to have liver failure, particularly for patients who have iron overloading. They may also this may also have an impact on how well your liver functions. So when we're looking at gallstones, this is general advice because we know the gallstones in sickle cell disorder, as I said, is triggered by the fact that you've got this high levels of bilirubin because of the red blood cells that are broken down. But general things to think about, or general factors to think about, is to avoid trigger foods, to eat regular meals, so don't skip your meals, to base your meals on starchy carbohydrates. Also considering a low-fat diet if fat triggers painful episodes. Having, again, lots of fruits and vegetables, so your 5 a day definitely, and aiming for slow weight loss. So if you do live with sickle cell and you're trying to lose weight, so try and have slow weight loss so that you don't trigger this cholelithiasis or the development of gallstones. So with liver disease, again, just some general sort of guidance to be aware of. So there you go. Include lots of fruits and veg in your diet. You can't get away from it. So including whole grains such as brown rice, brown pasta, oats, rye, barley, quinoa. So again, thinking about what are you eating in your diet at the moment? What changes do you need to make based on, the information that you're getting from this evening's session, including lean meats. So that would be poultry, that can be turkey, as I said, fish, as well, beans, lentils, including healthy oils in your diet, so avocado, oils from nuts and seeds, limiting alcohol intake, because we know that excess alcohol can definitely result over time, can result in liver damage. So you want to reduce and limit your alcohol intake to within the safe limits of 14 units per week for males and females, and you want to stop smoking. Great. We're making good progress. So now we want to move on to the spleen. We've already heard that, there is for sickle cell patients, the impaired functioning of the spleen is a problem that can increase your risk of infection. So the function of the spleen then is to filter the blood, to store blood cells, to produce white blood cells, but also to produce antibodies in terms of the immunity. So the impact on sickle, it can result in splenic enlargement, so enlargement of the spleen, and also fibrosis of the spleen. It can result in what's called acute aplastic anemia, so where the body fails to make enough blood cells, and parvovirus B19, and also functional asplenias, where the spleen doesn't function properly. So what can you do to reduce, to manage impaired immunity and also to reduce your infection risks? So some of the general guidance, and this is just general and very brief, because session 4, we will be going into a lot more detail. So just to let you know, this is just sort of general information. And we will be covering this in a lot more detail in session 4, so don't miss out on session 4. So general nutrition guidance to be aware of for now is to know to increase antioxidant-rich foods in your diet, so vitamins A, vitamin C, and E, to include anti-inflammatory foods such as omega-3 fatty acids, turmeric. Again, eat enough protein and energy-rich foods, because we know that impaired immunity can increase your malnutrition risks. So we want to have and make sure that we're taking in enough protein, enough energy. We want to make sure that we are paying attention to our gut health, and we will do a lot. We'll speak about this again in session 4, and also think about functional foods like pro and prebiotics. And again, as I said, I'll say a little bit more in session 4 on these functional foods. So the hepatobiliary systems, the function of the system is to help to drain waste from the liver, but also to control bile for digestion. And the impact on sickle cell. So it can cause indirect hyperbilirubinemia. Yes, did I say that correct? Rubinemia. And all that means is that there's high levels of bilirubin in the blood. And as I mentioned earlier on, that the chronic hemolysis leads to this high levels of bilirubin that's in the blood. And so this is the buildup of bilirubin in the blood, as I mentioned, and this is actually what causes the yellow discoloration of the eyes and the skin, which is called jaundice. Are you doing okay? I know I've given you a lot of information, but hopefully you're taking notes and you're following me. So we'll carry on with the cardiopulmonary system. We've got about half an hour left, so we will crack on. So in terms of the cardiopulmonary system, so cardio meaning referring to the heart, pulmonary referring to the lungs. So the function of the cardiopulmonary system, then it is the body's chief engine in terms of the heart, delivers oxygen and nutrients and hormones to the body. Also other important substances to cells and organs, and removes the carbon dioxide from the cells. So the impact on sickle cell, particularly pulmonary hypertension, and this is high blood pressure in the arteries of the lungs, cardiomegaly, which is enlargement of the heart, and also cardiac failure. So when we're looking at the heart, in particular, looking at some general nutritional risk and guidance. So following a cardioprotective diet, and what does that mean? That means having fruits and veg, your 5 a day again. Whole grains, I've been speaking about whole grains throughout the slides that I've mentioned already. Lean protein, by now you should know what lean protein is. So if you know, put it in the chat. I'm going to check afterwards to see if you've been listening and paying attention. And also healthy fats. is important in terms of, having a cardioprotective diet. Thinking about omega-3 fatty acids, again, from your fatty fish, but also from plant sources. And as I said, I will be looking in a bit more detail in session 4 at what this looks like. Looking at maintaining a healthy blood pressure. We already heard that maintaining a healthy blood pressure is important if you suffer from sickle cell nephropathy, kidney nephropathy, or renal nephropathy, sorry. So a healthy blood pressure is equally important in terms of maintaining a healthy heart, a healthy weight. Again, if we need to lose weight, it's important, again, in terms of keeping and maintaining a healthy heart, but also engaging in regular physical activity. So lots of practical things in terms of your diet, but also in terms of lifestyle that can help to keep the heart healthy. So looking at the lungs in particular, we're looking at the pulmonary hypertension in particular. So when you have pulmonary hypertension, it does impact on your lungs and how hard the lungs has to work to do what it needs to do. And so that can definitely have an impact on increasing your energy requirements. I remember a patient when I was working the sickle cell service who experienced pulmonary hypertension and was really struggling in terms of obviously increased breathing, shortness of breath, and all of that was increasing her energy requirements. And so definitely paying attention to include enough energy and protein-rich foods in your diet. And if you are smoking, to definitely avoid smoking and to stop smoking if you are smoking. So this is the last of the sickle cell related systems in the body. So the central nervous system, the function there to work together to control and coordinate the body's functions. It's the body's processing center. So the brain is the body's processing center, and it's where the body sends out and receives signals and information to other parts and other organs of the body. The impact on sickle cell for patients is in relation to strokes, and many patients will also end up with silent infarcts. So what are we doing, and what shall we do and pay attention to when you are experiencing a stroke or silent infarcts, or reducing your risk of stroke in terms of your diet? So again, healthy eating, we can't get away from this healthy eating, healthy balanced eating, following a cardioprotective diet. And put in your chat, can you remember what I said in the previous slide? What is a cardioprotective diet? If you remember, put it in the chat. I'm going to check afterwards. So following a cardioprotective diet, cholesterol lowering diet and lifestyle. And again, with this, I'm going through it very briefly, not in a lot of detail, because I will be covering this in detail in session 4. So this is just sort of to give you some information to start off with. So do register for session 4. We'll be covering this in a lot more detail. So engaging in regular physical activity, we know that for sickle cell patients, the advice that they would have been given is, to reduce and limit your physical activity. But this doesn't mean going to the gym. It could mean, engaging in either walking, it could be engaging in chair-based activities or just movement, not just sitting around, engaging in movement, and any movement is better than you not doing anything. So engaging in physical activity, and then also not forgetting stress management. So we know, as I've mentioned earlier on, that patients living with sickle cell can experience depression, anxiety, and also sort of high levels of stress in relation to managing a chronic condition and just, some other stresses in life. So make sure that you manage your stress, make sure that you're able to rest, and giving your body enough time and opportunity to recover. So I've included this slide because I was asked recently by a patient who has SC disease in terms of maintaining good health. eye health. And so this slide is basically to provide some information, nutritional sort of guidance around, how you can improve and maintain good eye health when you're living with sickle cell disorder. And so including in your diet, in this image there, I've included a picture of carrots, a selection of different colors, fruits and vegetables. So milk, eggs, healthy oils, fish in terms of omega-3, oily fatty fish, and beans to provide nutrients such as antioxidants, vitamins A, C, E, zinc, and omega-3. And so again, if you do have SC disease and you are experiencing retinopathy or problems with your eyes, make sure, if you don't already include some of these, if not all of these foods in your normal diet, then make sure to include these foods to ensure that you can maintain the health, your eye health to the best to the best of your ability. All right. Good. So that's the end of part 4. And again, it was quite a lot of information to get through, but I hope it's given you some helpful insights into what are some of the sickle cell related problems that you can experience and how that can impact on your nutritional needs, risks, and challenges. So we're coming on to part 5, which is how do we apply the Eat Well guide to managing your nutritional risks? So some of you who were in session 1 would have seen me share the first ever sickle cell nutrition Eat Well guide. And so for those of you who are seeing this for the first time, do make sure to download your copy from the Sickle Cell Nutrition Academy website. So I'm really pleased that this was co-designed by sickle cell patients, and this is tailored to the specific nutritional needs and problems of sickle cell patients. And so the Eat Well guide, as you can see just very briefly, has got this 5 food groups there. But what is different about the Eat Well guide, the Sickle Cell Nutrition Eat Well guide, is that we've included key messages within the Eat Well guide that pertains to some of those common nutritional problems that I've already included in session 1 and touched on in part 4. And so at a glance, you'll be able to not only see the foods in relation to your cultural diets and preferences, but you'll also be able to get some really good messages about what are those common nutritional problems that you need to pay attention to when you're living with sickle cell. So those messages that I've mentioned, this slide just highlights what those 7 key health guidance or messages is that's within the Sickle Cell Nutrition Eat Well guide. So the first one, and that relates to the yellow section, which is your energy or your carbohydrates and foods section, and that's all about you increasing your energy intake, because we know now that sickle cell, because of the chronic hemolysis, that can increase your resting energy expenditure, increase your energy requirements. So that's the first one to highlight. The second one is increasing your protein intake, and that is the message that's found in the pink group there. So increasing your protein intake, protein foods. The third one is in relation to regulating your immunity to include antioxidant-rich foods, vitamins A, C, and E, and also reducing inflammation. So 3 and 4 relates to the green group, which is your fruits and vegetables. So your 5 a day again, as I've mentioned earlier on. So the 5th key message is improving your bone health, which relates to the blue section, so your dairy and dairy alternatives. The 6th key health message is in relation to preventing dehydration. And so you can see there the difference between the amount of fluid that is highlighted in the standard Eat Well guide versus the Sickle Cell Eat Well guide. You will see there that it's 8 to 10 cups or glasses of water per day, as opposed to the normal 6 to 8 glasses. So having more fluid to reduce, prevent dehydration, because we know that dehydration is one of the common triggers for sickle cell crisis. So we definitely want to pay attention to that. And then the seventh message there is to choose healthy option, which is in relation to the traffic light system, as you can see there in the image, but also in relation to taking reducing your intake of high processed foods that contains a lot of fat and sugar. So we're going to move on. If it will move to the next slide. So this slide here is, again, a slide that we covered in the previous session, but it just highlights the 5 food groups that I've mentioned. So it's your carbohydrates, or your starchy carbohydrates, which is the yellow section. And again, carbohydrates is the best source of energy. The brain needs the glucose that we get from the carbohydrate food. So if you are cutting back on carbohydrates, remember that your brain needs the glucose. So don't cut it out completely. Choosing a whole grain or complex unrefined carbohydrates is your better sources. When you're thinking about protein, protein is, again, a very important nutrient for good health and vitality, but importantly, it's needed for growth and development, and it's a key part of all the tissues in the body: bones, nerves, hair, skin, and hormones. Remember, if you don't take in enough energy foods, your body will use your protein, your muscle stores, as energy. So you have to take in enough carbohydrates or energy foods so that your body can actually use the protein in your diet for that growth and for the repair. Thinking about vitamins and minerals, it's like your green group, your fruits and vegetables, again, really important, these nutrients for maintenance of health, prevention of disease. And in terms of minerals, again, there's a range of physiological processes that requires minerals in the body. So we need to ensure, and these are essential nutrients, which means that the body can't make it. So in order for you to get enough vitamins and minerals, you need to take it through your diet. Water, we've already identified the importance of taking in enough water to reduce your risk of dehydration, to improve how well the kidneys can work, but also our body's made up of over 70% of water, and so water is essential for all the physiological process of the body. And fiber is important as well to keep the digestive system healthy. It's sort of the broom of the digestive system, so we want to ensure that we're taking in enough fiber-rich foods. Just keeping an eye on the time. We've got about 15 minutes left. And so the next couple of slides will just be talking you through sort of how you can apply the Eat Well guide to specifically your cultural foods. I'm focusing specifically on African and African Caribbean foods. I have received permission to use slides from World Foods that I got from the Carbs and Cals app. So the Carbs and Cals, I've got my copy of my book. I don't know if you can see, but it's a really fantastic resource. So this is something that I would recommend that you get, because it covers a range of world foods, as I said, African, Caribbean, but also South Asian foods. And the next couple of slides, as I said, will cover some of the foods that I got permission to use, but I use the app. So you can download the app. If you don't want to get the copy of the book, you can download the app. So let's get cracking. So this slide here is basically just to show you an example of how you can tailor nutrition advice to cultural foods, and specifically we'll start off with African meals. So the image that I've included here is beef stew, amala, and okra. And what I want to highlight with this is paying attention to the portion sizes of these foods. So you're not saying you can't have these foods, but pay attention to how much you're having, because remember, it is about not only the type of food that you're eating, but it's also the amount of foods that you're eating. And we want to maintain a healthy weight. So in order to maintain a healthy weight, we want to take in the right amounts, the right variety, the right amounts of foods. And as you can see with this slide, that you can do that by eating your traditional foods, but just paying attention to how much you're having. So the next slide again is an example of this is egusi soup and gari. So if you're following an traditional African diet, again, you can have these foods, but it's how much you're having, and also paying attention to how do you prepare these foods. Yeah, are you using a lot of oil? What type of oil are you using? So paying attention to those key factors as well. So there's a range of different African meals, and I've listed there beef stew, egg stew, fish stew, chicken stew. And again, if you're thinking about getting a copy of the Carbs and Cals World Foods book, they've got examples of all of these foods in there. But what I wanted to draw your attention to this again is you can have these foods, but pay attention to the Eat Well guide. We've gone through the 5 food groups, thinking about, if you're thinking about beef stew, for example, how much are you having? How are you preparing it? What are you adding? If you're making a stew, are you using what type of oil are you using when you're making your stew? Can you add in extra fruit and vegetables if you're not, or fruits, vegetables, if you're not taking in enough, in your normal diet? So it's just paying attention to when you are preparing your foods, your traditional foods, thinking about the Eat Well guide, thinking about those key messages. How can you adapt that to ensure that you're getting that balanced diet? You're making the best nutritional choices to ensure that you can have and build a good nutritional status. So this is 2 examples of healthy African meals, and you can see there, you still have examples of your traditional foods. You've got the plantain there, which has been boiled in this example. You've got your chicken, you've got your jollof rice, and you've got your greens. So again, thinking about what does your plate look like? Does it resemble this? And how can you make those adjustments? The bottom example there is, again, chicken stew, and it's got jollof rice, it's got some fried plantain, 2 bits of fried plantain. How many bits of plantain do you have on your plate? Is it more than that? And if it's more than that, how do can you make the adjustment? And, on this example there's half of the plate has salad. Do you have salad as part of your meal? So it's making these adjustments, thinking about the Eat Well guide, and how can you still have your traditional foods, but enjoy it, but ensure that you're still having a balanced diet, and that contributes to you building and maintaining a good nutritional status. Another example here is spinach stew, gari, moi moi, and beans. Again, you can have that as part of a healthy African meal, but portion sizes, how much are you having? Can you see the distribution of the stew on the plate? And it's got some greens there as well. It's got some beans there as well. So again, how can you modify, improve your traditional meals, your traditional foods, enjoy those foods, but still ensure that you're getting in the nutrients so that you're maintaining a good balanced diet, and ensuring that you have a good nutritional status. So thinking about other examples, okra stew, ogbono soup, peanut soup, pepper, goat soup, spinach soup. Again, same principle as I've been talking through. When you make those foods, what are you using? How much are you using? If you're using oil, how much oil are you using? What type of oil are you using? And make those adjustments so that you can get the benefit and the enjoyment, but still ensure that you're not compromising your health. So thinking about sides and snacks. So amala, banku, fufu, gari, moi moi. So again, all of the foods that I've heard people say that they normally have in their diet, and some people have cut it out. So again, it can be part of your normal healthy diet, but it's thinking about preparation, portion sizes, and how can you, as I said, include that by not compromise on your nutritional health. Thinking about sides and snacks, and again, when I've been to parties or celebrations, I've been offered chin chin and puff puff. So we know that these are sort of common sides and snacks that is available. How much are you having? Are you having a whole plate? The example here is 2 puff puffs, a handful of chin chin. How much are you having? What else are you having? When you're having a jollof, is it a whole plate full of jollof, or having a side, a side portion of it? So it's just paying attention again to the amounts that you're having so that you are not compromising your health. Oops, go back. So same thing applies to your desserts and drinks. So I've included an example of the mushadania, which is fruit salad, papaya, banana, and sugar. Do you need the sugar? Just the question, do you need the sugar? So you can still have your fruit salad, you can still have the papaya, you can still have your banana. And I'm hearing some people say, but that's how we make it. But remember that we're trying to ensure that you achieve the best nutritional status. So sometimes it's going to mean that you're going to have to make some adjustments. So I'll leave it with that, leave it there. So other examples, carrot cake, again, you can have it. How often are you having it? Thinking about the Eat Well guide, thinking about the foods that are high processed, that contains a lot of fat and sugar, eating those foods less often, having smaller portions of it. So not that you can't have it, but just having it less often. So we're going to go through quickly the Caribbean meal. So that was going through the African meal. So now we want to go through the African Caribbean meals. And again, very common, curried goat and rice and peas. Yes, you can have it, but how much are you having and how are you preparing it? And so, paying attention and making sure that you make those adjustments so that you can get the enjoyment, but not compromising your health. So this is another example of fish, dumplings, green banana, and there's some salad there. Again, you can have all of those, and this example, shows you that. But thinking about how much am I having, as I said, not compromising your nutritional status and nutritional health. Again, examples: jerk chicken, rice and peas, plantain, oxtail and rice, stewed chicken and rice, red pea soup. When you're preparing these foods, you can have them. If these are your staples, you can have them. But paying attention, what ingredients are you using? How much are you using? Are you adding in the OXO cubes? We know now that reducing salt can help in terms of your kidney health, etc., etc. So it's just paying attention to what you're doing, what types of foods you're choosing, the portion sizes, and making those adjustments, as I've mentioned already. So examples of healthy Caribbean meals. So you can see there, so a half of the top plate there you can see is your okra, you've got your greens, you still have, some rice and peas, you've got your jerk chicken, but just the portion sizes all together and the balance of your food is completely different. So paying more attention to including more of those greens, more of your 5 a day. The bottom example there is the same. You've got your rice, you've got your salad, you've got your veggies, and you've got stewed chicken. Nothing wrong with that, but portion sizes and getting the balance right of the distribution of your foods. That is the thing to remember. So an example of healthy Caribbean meals, you can see there again, there's curried goat, there's plantain, there's veg, rice and peas, and just looking at and maintaining a really good balance. So more of your greens, more of your veg, and less of your protein foods and your starchy carbohydrates. So the same thing as I've done with the African meals, it's the same thing with the Caribbean snacks and desserts. Yes, you can have your snacks, but how much are you having? How often are you having it? This is meant to be having, not often. So now and again, it's a treat that you have these. So just paying attention to the frequency, the portion sizes. And again, if you get a copy of the World Food Groups, it's a really helpful resource in terms of showing you what the portion sizes are, what the calories, what the protein content is, and that will help you in terms of making those adjustments. Applying the Sickle Cell Eat Well Guide to Caribbean snacks and desserts. And many of you will be thinking, I really fancy bun and cheesecake right now. So yes, you can have it less often, but again, portion sizes. The bigger the portion size, the higher the calories, the higher the fat, the higher the impact, negative impact it has on your overall health and well-being, your nutritional status. So have this, but pay attention to the portion sizes. The same thing to the drinks. Which drinks are you having? Ginger beer, out of all of that, has the lowest calorie content. So what do you normally have? Do you have it on a regular basis? Is this a daily thing? Is it a weekly thing? How often do you have it? Again, paying attention to how much you have and the total calories as well. Applying the Eat Well guide to your drinks. And I've listed a range of drinks. And again, out of there, so something like Nourishment has got quite a lot of energy. And I know many of you would use the Nourishment in terms of a meal replacement, and it works perfectly well in that context. But if it's a snack, then it definitely is a snack that will provide a lot more energy or calories than you may need. So just pay attention to that. Enjoy it, but it's not something that you should be having every day, or so pay attention to how often you have it. And the bottom two, I mentioned condensed milk and evaporated milk. The fact that it's called milk doesn't mean that it is milk. And as you can, and if you're thinking about the Eat Well guide, certainly does not fall under the blue section where we cover the milk and milk alternatives. This would more likely come under the processed foods, because it contains quite a lot of sugar, quite a lot of fat. So you definitely want to, if you're having tea or coffee with evaporated milk, food for thought. If you're having tea or coffee with condensed milk, food for thought. So just to be mindful, again, in terms of, the overall diet, what you're trying to achieve. As we started with a recap, we're trying to achieve the best nutritional status for you living well with sickle cell. And it will mean that the way that you maybe used to eat will need to be adjusted a little bit, but hopefully not too much, so that you don't enjoy your food anymore. But if you are able to make those adjustments, then definitely that will have a positive impact on how well you can live with sickle cell, and also reduce some of those nutritional risks, challenges that I've mentioned. So that's the end of part 5, and I really hope that you got some useful information from that section. And so we've got just a few minutes left before we finish, so I'm going to round off this evening's session with part 6, which is about empowerment and lifestyle tips. But tonight it's basically a summary of all of the things that we spoke about over the different parts of this evening's session, and it's just as a reminder for you to think about what changes, what goals you will be taking forward based on what you've heard and taken from this evening's session. So the first one is take control of your nutritional status and health. I've spoken about that. I've highlighted that throughout the slides that I've covered, and it definitely comes down to you, making that initiative. And again, the changes, it may be that you start with 1 or 2 changes that you're able to make from this evening, or if you've attended in the first one as well, that you've already started making in the first session. But do decide today to take control. It is within your hands to a degree. You may need support, you may need encouragement and guidance, but definitely start, taking control and at least take away 1 or 2 steps that you're going to do differently moving forward. Apply the Eat Well Guide to support your food choices and healthy eating behaviors. As I said, if you've not already downloaded the Eat Well Guide, then please do. You can download that from the Sickle Cell Nutrition Eat Well Guide, website. And, look at it again, go over it again to make sure that you've understood it, and use that, print a copy, leave it in your kitchen, speak to the kids, about that as well, and definitely try to apply that as you're buying your food, as you're preparing your food, and as you're eating your food. So in terms of point 3, know your sickle cell and how it affects your health and well-being. I've gone through a range of sickle cell related problems, looking at how sickle cell affects all of the organs and the systems of the body, and how nutrition can help ease and relieve and prevent some of the impact of that. So definitely take time and pay attention to how sickle cell is affecting you and those systems, and what changes you can make in terms of your diet to improve and reduce your risk. So point number 4, understand the complexity of your nutritional needs and well-being. And this I refer to, the slide I identified the personal internal and personal external factors, not just looking at nutrition and the Eat Well and, the Eat Well Guide and the food side of things, but what are some of those other factors, that impact on nutritional needs, your mood, your beliefs, culture, your support, how sickle cell affects you and all of that. So understand the complexity of your needs in regards to that as well. So point number 5 is knowing your nutritional needs, risk, and challenges. Definitely from session 1 and session 2 today, try and identify what those needs, risk, and challenges are. And remember, I identified those 4 key concerns and risks. If you're experiencing any of those, then please do flag them up, raise them if you're having an annual review appointment coming up, or if you've got a GP appointment, or if you've got your routine appointment with your nurse or the consultant, do flag that up and get yourself checked and the support that you need to manage that. And then the last one, point 6, is understand why improving your nutritional status and health is important to living well with sickle cell. So hopefully session 5 or part 4 of this evening talk would have given you insights into that. And as I said, some of the tips and information that I provided was, I didn't go into a lot of detail. I will be touching on a lot of this in session 4 in a lot more detail. So do, as I said, do register. So as we come to a close, I just again want to draw your attention to the Sickle Cell Nutrition Compendium. And this is some of the wonderful participants who was part of the project, where we designed the Eat Well Guide and the other nutritional resources that's available on the website. So do check that out as well. And then as we conclude, so it's just 20:33 at the moment, thinking about one thing you will take away from this evening session, put it in the chat. I'm going to look after, we conclude the session, what you said. Hopefully there's at least one thing that you will take away from this evening session. Yes, so hopefully you would have, really, been able to do that. And yeah, so that's the end of this evening session 2. I hope you found it helpful. I ended off last week's session. I always end all of my presentations with these 2 quotes. So on the end of this one as well, every closed door brings you closer to your destiny. That has been my experience over this 10-year journey of advancing sickle cell nutrition. It's not been easy, but I'm grateful, for how far I've come. And also, do not go where the path may lead, go instead where there is no path and leave a trail. And I'm really grateful that I can be contributing to the advancement of sickle cell nutrition in the way that I am. So thank you so much for joining and staying. I'm going to stop sharing for now. And yes, just thank you so much for